Nasal airway obstruction is very common amongst many people. Sometimes it's due to a deviated septum. Sometimes it's due to swelling of the lining of the nose. Often patients come in with lateral wall collapse, where the side wall of the nose obstructs when you breathe in. They say they're blocked, they can't breathe. The best test is to do what's called a modified caudal, and that's actually to use a little ear curette or Q-tip inside the nose to open up the nostril. And then I ask the patient, what percentage improvement do you feel when I support the lateral wall, or do you feel any improvement at all? The non-surgical treatment options, such as nasal sprays, which treat the lining of the nose, are really insufficient to treat nasal airway obstruction. If I can open up the airway by 2 millimeters, that translates to an overall increase in the area of the nose by about 8 millimeters. You don't need a lot of stabilization in order to get a significant improvement in nasal breathing, but you certainly need stabilization of the side wall of the cartilages. There are breathe right strips that are available, and that may offer some benefit, but often patients want a more permanent solution. Now we have a treatment called the LATERA implant. The LATERA implant is a safe, effective treatment for collapse of the side walls of your nose. The studies are very promising in demonstrating long-term efficacy. And in addition to that, it's a product that's designed by otolaryngologists. And it's also been looked at and tested by facial plastic surgeons as well as rhinologists. I use LATERA in my practice for several reasons. One, I have a large proportion of patients that don't want a cosmetic change to their nose, but they want to breathe better. And the lateral nasal wall causes a problem for them. Second, we have the CPAP intolerant patient. And we know that if we improve nasal breathing significantly, right? So by doing a septoplasty, turbinate reduction, if we improve the nasal valve, we can drop the CPAP pressure. Third, we also offer LATERA for patients who don't want to go to the hospital for surgery. They want an office-based procedure. And so this is a procedure that can be done with quick recovery, minimal downtime, and really no general anesthetic if that's an option the patient chooses. And go ahead and breathe in, Robert. There's really not collapse occurring like was before. Breathe in. We don't know at this point whether LATERA needs to be replaced. With aging, the body may need some continued support. But I feel comfortable in telling a patient that even if I place a LATERA implant today, we may need to support the lateral nasal wall in 5 years, but they've had improvement in quality of life during this time frame. Patients that come to my practice, they want improvement today. They want to be able to breathe better today. They want an improvement in their quality of life today. Really to balance out appearance and so really form and function, I think that LATERA hits the nail on the head.